Hi there, friends. Welcome and thanks for tuning in for this weekend edition of Jamaica Magazine. I'm your host, Theodore Henry. Coming up in this half hour, Western Roundup returns with a look at smart healthcare facilities. And we also explore what you can do to protect yourself against diseases. Stay with us for all these and more after this important message.
The following is brought to you by the Office of the Prime Minister.
The best indicator of Jamaica's capacity in managing the health system would be the number of beds that we have. And we have to be very careful about how we as a country loosen our measures, because very rapidly this virus could spread and the number of beds that we have could easily be used up. That would throw us into a crisis. It was not so long ago that we approached that crisis level. We do not want to get there again.
The proceeding was brought to you by the Office of the Prime Minister.
Jamaica and other countries in the Caribbean are prone to natural disasters such as hurricanes, floods, and earthquakes. But the effects of these threats can be reduced by building safe and resilient infrastructure and systems, as you'll see inside this week's Western Roundup.
Have you heard about the Smart Healthcare Facilities initiative being implemented by UKAID and PAHO in collaboration with the Ministry of Health and Wellness? If yes, today on Western Roundup we have an update for you. But if not, we highlight the St. Anne's Bay Health Centre along with 8 other centres that have recently benefited from the project. Stick around. 9 health facilities have been handed over to the Ministry of Health and Wellness, having been retrofitted under the Smart Healthcare Facilities in the Caribbean project.
Today marks the culmination of 11 months of work, resulting in the handover of 9 health facilities, which were retrofitted using WHO PAHO's SMART standards at a value of 320 million Jamaican dollars. The St. Anne Bay Health Facility was retrofitted to improve the resistance across a range of hazards, including strong winds, flooding, and earthquakes, and to boost the greening of the facility, and this one at a value of 140 million Jamaican dollars.
The other 8 health facilities include the Albertown, Darlaston, and Gale Health Centres, which were rehabilitated at a cost of 146 million Jamaican dollars, and the Cumberland Road, Norman Gardens, Sydenham, Wyndham Road, and the Yallas Health Centres at a total cost of 34 million Jamaican dollars. 3 additional health centres, Mandeville, Port Antonio, and Santa Cruz, will be completed in the coming months. The project aims to create safer, greener health facilities to deliver care after disasters and build climate resilience. The facilities have also been retrofitted to provide better access to persons with disabilities. In the meantime, workers at the St. Anne's Bay Health Centre are praising the initiative and the impact the changes have had on their work environment.
I definitely appreciate the improvements that have been made to the health center. Actually, I've been here since the improvements, but what I've noticed is that the facility looks good. The patients have given their feedback that they like how it is now. There are more offices available, so there is less wasting time as there are more offices for doctors to work from, and the facilities are better in terms of water supply and lighting and ventilation.
I'm grateful to experience such an improved facility due to the improvements that were made by PAHO. With the pandemic going on, it makes it easier to manage these patients in a better environment.
Really are happy that we have the facility. We opened back our doors on November the 29th, and we know that it will do a great level of service for the community. We have a lot of doctors here who are very excited. Persons are going to be coming and having efficient service. So we have a smart facility, and when we say smart, we mean that it is actually safe and it's actually green. We have quite a number of things that have been improved at our facility or clinicians area. We have water storage capacity. We now have a generator, which we're very happy about. And so, if we should lose electricity, the patients will not suffer for it. They will be able to access care in a setting that is still very comfortable. They will not even know that something has gone wrong. And so I just want to thank the British government as well as the Pan American Health Organization for their assistance in making this a reality. So thank you so much.
The same sentiments have been echoed by Minister Tufton, who has indicated that the St. Anne's Health Center has become a model for other health facilities.
Today on display is a model program. The facility that has benefited here is an indication of a model that we all need to follow right across the length and breadth of the country. A facility that is assessed based on its capacity to withstand threats, natural disaster threats. Because ultimately, no matter what happens from a disaster perspective, a health center and a hospital is supposed to stand strong with the support of its people to respond to those who need those facilities and that type of service. And invariably, if they fall, then clearly the response is going to be that much weaker. And what this smart healthcare facility is intended on doing, and I'm happy to hear about the 70-odd point scoring system outside of the 30 plus that we had, or 27 that we had before. It means we're improving. It means that we are now coming to terms in our system, along with the partners that we have joined forces with, the UK, PAHO, WHO, with the need for us to think about our healthcare infrastructure in a much more holistic term. Linking it to the environment, linking it to the people, and the training and the conditioning of the people, so that we can more effectively respond to the communities, in the first instance to prevent, but also importantly to cure.
Funded by the United Kingdom's Department of International Development Fund, DFID, at a cost of $9.6 billion, the Smart Healthcare Facilities Initiative is being implemented by PAHO in collaboration with health ministries in selected countries across the Caribbean. That's all for the program today. We hope you learned a little bit more about the smart healthcare facilities in the Caribbean project, and we encourage you to check out the retrofitted facilities that are near you. Remember to send your feedback to jismobe@jis.gov.jm. Until next time, stay safe.
Mosquitoes can spread diseases such as dengue fever. Protect yourself from mosquito bites. Use a mosquito repellent that contains DEET. Sleep under a mosquito net, close windows before dark, open windows and doors during fogging, cover your body as much as possible, and wear light-colored clothing. Protect yourself from dengue and other mosquito-borne diseases. Do your part to prevent mosquito breeding in your surroundings. A message from the Ministry of Health.
Controlling the triple threat of COVID-19, influenza and dengue is a major agenda item for the Ministry of Health and Wellness. This mission requires every one of us to always be vigilant and take preventative measures against the spread of these infectious diseases.
Knowledge is power, and our awareness of this triple threat is the first step to victory. The next step is to do what we know needs to be done and can be done to protect ourselves and the people we care about. COVID is still out there, requiring continued vigilance in our national response to the disease, including the strict adherence to infection prevention and control measures. Masking up, we must add the masks, washing the hands, keeping your physical distancing from others, and sticking to quarantine or isolation as is required.
The Health Ministry has maintained a robust testing protocol in the COVID response to track and trace the virus and slow its spread. That includes government's approval for some private entities to carry out the gold standard polymerase chain reaction PCR test for COVID-19, as well as the antigen test, which has a quicker turnaround time for results.
Combined private sector entities are now able, for a cost or for a fee, to offer the PCR test for COVID with the sanctioning of the Ministry of Health and Wellness. And so you can go to a microlabs, and they're all over the country. You can get swabbed, samples collected, sent into Carigen, and Carigen will do the tests, turn it around, and send back the results. In addition to that, the ministry has also approved Technology Solutions Limited to do environmental testing. And what this means is that this entity, Technology Solutions Limited, is able to go into your company or your home or wherever else in a public space, and they can test surfaces to determine if the virus exists on those surfaces.
Infection prevention measures for the flu caused by the influenza virus is the same as for COVID-19. They include covering the mouth and nose and coughing and sneezing in a piece of tissue, which is then properly disposed of immediately. Both COVID and the flu are highly infectious diseases requiring persons with symptoms to stay at home and avoid contact with others in order to prevent spread. Both have similar symptoms, which makes it difficult to tell which illness is present. Common symptoms of the two infections include coughing, runny or stuffy nose, and shortness of breath.
And so it's very important that as citizens, if you have any of these symptoms, you get checked out by a doctor. And it's also important that you do not panic, but at least get the diagnosis to determine which of the two or indeed the three you may have. Because depending on what you have, your treatment would vary.
The flu season begins in November of each year and extends to March. However, it can be longer, starting earlier in October and lasting until May. The government has made 23,000 doses of the flu vaccine available free of cost for the most vulnerable in the population. Persons can get the vaccine at public healthcare facilities across the island.
The priority for this vaccine would be healthcare workers initially, pregnant women, children over 6 months with chronic illnesses, non-health frontline workers such as the police officers, army, correctional services, customs, and immigration officers, and transport operators, institutionalized persons, those in the infirmaries, nursing homes, and the elderly, 65 years and older, and those with chronic illnesses. And indeed, I would say parliamentarians too, persons or public officials, elected officials who are on the ground in the communities, interfacing with a wide cross-section of the population. They would represent a risk. I would certainly want to encourage those, particularly of a particular age cohort, to seek out, and you can get it done privately, the vaccine, because it certainly will assist in protecting you against the flu.
Shorten the duration of any flu-like illness that you may get. The severity will certainly be lessened. The hospitalization will be decreased. What has been shown when we look at what occurred in the Southern Hemisphere for their winter season, it was shown that persons who received the flu vaccine actually, if they got COVID, their impact of the illness was much less, and they also had less deaths in persons who had received the vaccine.
Controlling the population of the Aedes aegypti mosquito, which transmits the dengue virus, is the most potent action to protect against dengue fever, the third tier in this triple virus threat. The mosquitoes are domesticated and usually live in and around areas where people are located. They breed in containers holding water.
We're talking about the vase that you keep on the whatnot, or the bucket that you might keep in the bathroom to store water because you don't have running water to flush the toilet, or the leaking pipe under the sink that you put a pan to catch because you didn't get a chance to fix the pipe. All of those things become breeding sites for mosquitoes and ultimately poses a risk to you.
The national response to this threat has brought the Aedes aegypti indices to a low level, following government's single largest investment of nearly $300 million in the island's vector management infrastructure.
We had in place over 1,244 vector control workers. 222 are permanent, so those are the ones on staff, but we engaged just over another 1,022. Those are still in place, and they have been out in the field doing the work, bringing the messaging, giving out the brochures. We've had 60 new vehicles that have been assigned to the vector control program. 36 of the 60 had vehicle-mounted foggers. We have 76 handheld fogging machines with another 35 in stock.
Citizens, meanwhile, are told to constantly monitor their environment for mosquito breeding sites and take action to prevent breeding.
Tightly cover our water drums, so secure our water storage tanks. The searching the drums and mosquito breeding sites, including our, all the things that I mentioned earlier. Once you see that little wiggly thing in the water, you know that mosquitoes breeding in it.
So, as we continue to take responsibility for our own health and the well-being of all around us, let's get informed and take action to stay safe.
Follow the protocols. What we do not want is to be overwhelmed as a public health response, where people don't have access to hospital beds, doctors, nurses, if they need it because of a dengue, a flu outbreak, or indeed COVID. And I think we can do that.
For those of us who do not believe that COVID is real and that it is here, have you been to one of those hospitals where the wards are overflowing with patients who are trying to breathe and talk at the same time, but find it so impossible to do so? Or have you seen someone die in front of you, trying to make the next breath to stay alive? So my fellow Jamaicans and colleagues, whether you believe it or not, COVID is real. So I implore you, social distance. Wash your hands, wear your mask, sanitize. Along with that, we need to keep our immune system nice and healthy, so you drink lots of water, eat your fruits and vegetables. But whether we believe it or not, COVID is here, it is here to stay, it's going to be the new norm. And remember, when you behave irresponsible, you expose all of us. So do the responsible thing.
We're entering Career Week, February 6 to 11. Have you considered a career in beekeeping or apiculture? It can offer sweet means of earning a living, as you will see in this next feature.
Apiculture is an art and it's a science. And it's an art and science of managing bees. So everything that we do in the hive, everything that is happening in the hive is very scientific. And as beekeepers, we craft the way how we manage the bees. So every beekeeper that you speak to, they will have a different approach to different aspects of beekeeping.
Given that the importation of honey into Jamaica is restricted, you can only imagine what big business beekeeping is for our farmers. They have expanded from just providing honey for citizens and have moved on to creating many different byproducts. But have you ever wondered how you can get involved and have your share of the sweetness?
For you to be a beekeeper, you have to develop certain comfort in dealing with this thing, which is not a maybe when you're a beekeeper in Jamaica. It is a must. So every time you get a sting, it becomes irritating to you. But then because we love what we're doing, we don't pay much attention to the irritating part. We're more focused on what we're doing, and we know that at the end of the day we're going to get honey. And when we get honey, we can convert that to money. So for us in St. Thomas, from time to time we have projects. And quite a few of the persons in St. Thomas who are beekeepers, they start out benefiting from projects that would have beekeeping components. So training is critical, because then you have to know how to navigate your way through an environment that is challenging to allow you to harvest honey and to make a livelihood from beekeeping. I would advise anybody who would like to make their own box to purchase a box to start with, or you borrow a properly made box, because the bees are very scientific. They're very specific in terms of the design of the space that they occupy. And if you make a mistake and where you're supposed to have 3/8 of an inch or 1/4 inch, you put 1/2 inch, or you put less than 1/4 inch, then you're going to have problem as a beekeeper. So a beekeeper has to be knowledgeable about what is normal in the hive. So I tell people that when you come into the apiary, there's a normal sound. And if you listen, you hear a hum. When I hear that as a beekeeper, I know that they're finding food out there. They're finding nectar, they're finding pollen, and so on, when I hear this hum. When you go into the hive, there are many things in there that you have to observe. Right? You have to observe the condition of the comb, whether the combs are, I always say, old and crystallized, because once they get old and crystallized, you want to get rid of those combs. You want to look at the color of the brood. When we say the brood, we're talking about from the larval stage now to when they get to the pupal stage. You want to observe that, because there's a normal way that they should look, and there's an abnormal way when something is going wrong that they would look differently. You want to observe the queen and the condition of the queen as expressed in the amount of eggs that are laid, as expressed by the amount of seal brood that you see. Right? In the bee yard, you want to be observant of everything. I usually tell trainees that when you come into the bee yard or into the apiary, you have to look around at the trees and the shrubs around, because there might be a swarm that is lingering. That swarm might have taken place in your absence. Might even be the very morning before you come to the apiary. You have to observe and see if any of that is there, because if you let that swarm escape, then you're looking at some dollars and some of your profitability that is going down the drain. You want to be able to have a bee yard that is not necessarily sterile, but clean enough that if you have dead bees around, you can see them on the ground. If you have bees that have been affected by the varroa mite and they are suffering from viral attack, there's a virus that they call the wing curl virus. Those bees, when they reach the age and the stage to fly, they cannot fly because the wings are deformed. And so those bees, you will see them crawling on the ground, and they will crawl around on the ground until ants get them or until they die.
That's just the bare bones of what you need to learn about beekeeping. Do more research to increase your knowledge. But as you do, ask yourself this: am I registered with the Rural Agricultural Development Authority, RADA?
It is of great importance for a farmer to become registered or get registered with RADA, because indirectly they assist us in making national plans. For example, when we are doing our national plan, knowing the demographics of the farmer, where they are, the type of production that they do, it allows us to pinpoint as to what projects or programs can be implemented. And also, if we should have disaster, diseases, we know where the concentration of farmers are located. or once you come to the RADA office, you can either speak with myself, the livestock officer, or the extension officer, and we'll provide you basic information on what is needed, how you go about it. We also give you the other linkages, such as the apiculture unit at Borders, that you can contact for other information. We also do assessment. We assist you in doing site assessments of your apiaries, and also kind of hold your hand in terms of getting started. And if we have projects or programs and we can have you on that project or program, we also put you there. The advice that I give to beekeepers is to do your production in a manner that has a business-like approach. From my observation, many beekeepers think that having the bees they're just there. They don't really take the time out to assess their apiaries. Mr. McNeish mentioned about sanitation. They don't really look at that. So I say just manage your apiary, monitor your hives, keep your proper record so that you can have a good production.
Getting the first dose is not an excuse not to wear the mask, not to social distance or physical distance, not to sanitize. Getting the first dose is not justification for deciding that you're going to resume the parties, the gatherings beyond the limits that have been established. The journey is to observe the protocols, take the second dose when it is time, and then we will resume some semblance of normalcy once we achieve herd immunity.
And that brings us to our final stop on today's journey through the pages of Jamaica Magazine. Thanks for your company. Be sure to join us again tomorrow. And until then, keep watching this and other programs on the JIS's YouTube channel. Visit our website, jis.gov.jm, and find us on all the major social media platforms and through our mobile app that's both Android and iOS compatible. On behalf of the entire production team, I'm Theodore Henry, reminding you to protect yourself and others against COVID-19, get vaccinated and maintain good hygiene practices, wear your mask in the presence of others, and stay safe.
This has been a production of the Jamaica Information Service, the voice of Jamaica.